basically work in all aspects of healthcare. So we're going to back up from hospice, and where geriatric care management comes in is when an individual or a family member needs some guidance. They're perhaps encountering a condition or an illness for the first time, or they're a new caregiver, and you're just sort of lost. What's next? What do we do? So geriatric care managers help you to navigate the healthcare system. And as you probably know, I assume a lot of you may be caregivers out there, as someone gets older, they begin to work within the healthcare system more and more, whether it's because they have conditions that they're having regular follow-ups with their doctor, something like Alzheimer's disease, and their care progresses, to in and out of the hospital, maybe congestive heart failure, various conditions. So geriatric care management comes in to help assess the situation and work with the family or the individual in planning for their care. And we do work with hospice quite a bit, but we also work in the very early stages of caregiving and everything in between. So let me just define for you, geriatric care managers are a health and human service professional. They're usually a social worker or a nurse or a counselor. And they have specialized experience and knowledge in the field of aging. So there's several different things that we do when we're working with the family. We provide information and assistance. We do assessment and care planning, and those are the two key things that we do, which I'll talk about a little more in a minute. We do service coordination. We help monitor services. We help with placement or relocation, education and counseling and support, and even long-distance caregiving. We assist with that. Our goal is to help the individual to be as independent as possible. And I say that with the understanding that sometimes being independent may mean having a caregiver or being in an assisted living facility. Because that individual often does not want to burden their family, they need assistance in just some of their daily tasks, and so we try to help them be as independent as possible. Of course, we always take into consideration that individual's preferences. We want to respect them and their wishes. So someone may say, I don't want to go into an assisted living, I want to stay in my home. And we will work with them to assist them to give them what they want. And just as you had mentioned with hospice, we want people to implement what things do we just want to put on the back burner for now? What things may be really urgent and then we need to address right away. And we help to identify that for you. We often will identify red flags that the family doesn't see. And that's something it's the old saying, you can't see the forest for the trees. So we try to point out, well, here's some things that we need to think about and discuss. If we continue to work with families after this point, it's often to continue to monitor services, to reassess services, and to help adjust the care plan as needed. Sometimes families just need someone to come in and do a consultation and help get through these first steps, and other times families need someone to help them all the way through. We have individuals who perhaps have family members out of state, and so we can act as the son or daughter might if they lived nearby and help get them to medical appointments and help them to coordinate their appointments and follow up to make sure that they're getting their prescriptions and maximizing the benefits that might be available to them through Medicare or anything through the Department of Aging. So we look at all of those various pieces and put together a plan. So with all of what we're doing, we're referring out a lot. We are not usually providing the hands-on care. So for example, if someone needed a caregiver in the home, we might help them select a caregiver. We might help oversee that caregiver and make sure that they understand their role. But we do not provide the direct care. We're more like a consultant in that way. but we have very good, strong relationships with those caregivers, particularly if we have clients that we are the main individual to monitor their care. So I always say, we're involved as much or as little as you need us, because it's not like buying a computer. It's very personal, what you might need and what you want from a care manager. So the relationship is really created as a team.